Okay, very good. We're ready to begin. Today we will be hearing Senate Bill number 568 related to cannabis authorization, regulation, and taxation, also referred to as the legalization of recreational cannabis, as well as Article 11 of the budget relating to adult use marijuana. So it made perfect sense to hold a joint meeting with the Committee on Finance. Additionally, Judiciary has several other bills on its agenda related to cannabis and/or marijuana. With that said, and in keeping with existing virtual protocol for this committee, I would ask for a motion to hold the 5 bills before the Committee on Judiciary for further study. May I have a motion to hold these bills for further study from someone from Committee on Judiciary?
So moved, Madam Chair.
Thank you. Senator Lombardi moves that
Second,
motion.
Madam Chair.
Thank you very much, Leader McCaffrey, for the second. Mr. Clerk, may I have a roll call vote, please?
Madam Chair,
Yes.
Senator Burke,
Yes.
Senator Oyer,
Yes.
Senator Lombardi,
Yes.
Senator Casada,
Yes.
Leader McCaffrey.
Yes.
There's 16 in the affirmative and none in the negative.
Thank you, and the vote is unanimous. Before we begin sponsor testimony related to the judiciary bills this afternoon, I am going to turn the meeting over to Chair Pearson for opening remarks and the presentation on Article 11. Welcome to the committee.
Thank you so much, Chairwoman Coyne. The Senate Committee on Finance is happy to join you this afternoon. We look forward to hearing both Article 11 and the very same issue that's been worked on very hard by both Chairman Miller and Leader McCaffrey, and hearing both of these proposals. I do know it is a priority for both the Senate and for the administration to complete this year. Joining us this evening for the administration on behalf of Article 11, we have Director Womer of the Office of Management and Budget. And Director Womer, I'm going to turn it over to you to begin the introduction and also introduce the remaining members of the administration that will be with you this evening or this afternoon.
Thank you, Chairman. It's a pleasure to be here to a joint committee. Very, very exciting. I'm going to turn over this presentation to Director Liz Tanner of the Department of Business Regulation. She's going to run through a slide presentation that I think everyone has in front of you. In addition, just to supplement and to help out, we have Anna Nevice, Deputy Secretary of the Office of Health and Human Services, Matt Santacruz, the Director of Marijuana Regulation in DBR, and Matt McCabe, our Chief Economist at the Office of Management and Budget. With that, I'd like to turn over to Director Tanner.
Thank you, Director Womer. Hello, everyone. Good to see you all again. It's been some time. I will be sharing a PowerPoint on screen, and I'm hoping it's going to work. Let's see here. Okay, great. I believe it's working. Jamie, is that correct?
It is good.
It looks great.
Great, thank you. The Department of Business Regulation is pleased to speak with you all today regarding the governor's budget article for adult use marijuana. Getting started, taking a look at our presentation, and you should feel free to ask any questions throughout. You can interrupt us at any time, and we can switch screens if you want to go off the presentation. First, we focus on our guiding principles for this budget article. Governor McKee's proposal is anchored on principles of equity, safety, and fairness. And these are reflected throughout the proposal, which features tightly regulated, privately run adult use licensees, a competitive tax structure, maintenance of local control, and an emphasis on public health and safety. On this next slide, we focus on licensing. The state contemplates a controlled rollout of adult use retail licenses, and current cultivation limits will remain in place. Our lottery-based system will ensure transparency, fairness, and equitable access to each year's allocation. We'll structure the lotteries such that the first 5 of each year's allocation of 25 licenses are awarded to qualified minority and women-owned businesses. There's the potential for new ancillary licenses, and will make existing compassion centers eligible by right for a new hybrid retail license that will allow them to service both the medical and adult use markets. Moving on, we discuss a controlled rollout. We believe a controlled 1 year at a time approach is the right way to stand up Rhode Island's adult use retail market. We'll closely monitor data on market conditions and retail activity to make a decision in the 3rd year of the program on how many, if any, additional retail licenses can be made available going forward. Next slide, we have a licensing framework anchored in equitable access. The new retail storefronts will represent major economic opportunity for entrepreneurs traditionally excluded from the legal cannabis market. We directly address this by setting aside 20% of annually awarded retail licenses and 50% of new license types for qualifying MBE applicants. This 20% set aside is in proportion with the non-white population of Rhode Island, which stands at 21.3%. And note that this concept relies on existing regulations defining minority business enterprises in Rhode Island and also includes women-owned businesses. Regarding local control, we maintain a significant degree of local control over the location and types of adult use cannabis licenses within municipalities. The statute allows for a moratorium on cannabis licenses by ordinance through November 2nd, 2021. Thereafter, towns may opt out of cannabis licenses by way of a ballot referendum. Towns can use land use and zoning tools to restrict the location and land use of cannabis licensees across the board. The proposal also permits the assessment of local impact fees to recoup associated costs of cannabis-related activity. As to public health and health equity, we invest a significant amount of year one revenues in a number of health and health equity related areas, with a significant expansion of funding for our proven health equity zones to collaborate to build out community-based health initiatives that will aid in our overall recovery from the health and economic consequences of the pandemic. We also aim to build capacity in our sister agencies of Rhode, Buda, and EOHHS in the realms of treatment, prevention, and surveillance, with a particular focus on adolescents and youth. Finally, the proposal creates the Governor's Cannabis Reinvestment Task Force, which will be co-chaired by DBR and EOHHS and charged with presenting recommendations for long-term investment of cannabis revenues in the specific areas of job training, small business access to capital, affordable housing, health equity, and neighborhood community development, among other things. Next is public safety. We aim to introduce adult use marijuana in Rhode Island in a safe and mindful fashion. We prohibit use or possession for anyone under the age of 21. We update existing DUI statutes to introduce cannabis-specific roadside and chemical tests. We invest $900,000 in state and local enforcement capacity building, with $400,000 invested in state police drug recognition training, and an additional $500,000 made available to local law enforcement agencies in grants through DPS. Importantly, we maintain our existing prohibition on home grow outside existing allowances in the medical program, allowing us to ensure safe, regulated product is the only product available in the adult use market in our state. I'd now like to turn it over to Matt McCabe from OMB. Matt, just let me know you want me to turn the slides.
Sounds good. Everyone. Is there a question from someone?
No question. Please proceed.
Thank you. This is Matt McCabe from OMB. I'm going to walk through the revenue and expenditure pieces of the proposal. This chart is very complicated, but hopefully looks familiar. This is very similar to the proposal from the FY20 governor's budget. And I think the best way to think about the revenue framework of this proposal is, pretty equivalent to how liquor is taxed in the state, with both a wholesale tax component and a retail tax component. So essentially, this proposal has a weight-based excise tax at the cultivation stage, which would be $10 per ounce of flower and $3 per ounce of trim. A retail excise tax of 10% on the final sales price, and also would apply sales tax to cannabis sales as well. And, there are kind of two rationales for this wholesale tax as part of this proposal. One is it creates a steady stream of revenue even though the price of cannabis fluctuates in the market, because it is a weight-based tax. And second, it does allow the state to, kind of dial up and down the price of cannabis as needed. I think the best analog here is with cigarettes, and I think there's been a push over the last so many years to increase the price of cigarettes to decrease consumption, and this wholesale tax would allow the state to just do something similar if needed. And essentially, this wholesale tax plus the retail excise tax and sales tax creates an effective tax rate of around 20%, which is in line with our neighboring states. All this revenue from the wholesale tax, retail taxes, and fees would go into the marijuana trust fund, and then be split between in three buckets. First bucket would be to the state for regulatory, public health, and public safety needs. The second bucket is to local governments, and the last bucket is to the general fund. The state share is 25% for the public health and safety needs. The local share is 15% of all revenue, and the general fund share is 60%. Furthermore, the local share is actually split up in a couple different ways, both by sales volume, which is the biggest component of that split, and also by license volume, and then an equal payment to each city and town, which we think would probably be around $30,000 in a full year of sales. And the goal there is to make sure that every town, even towns without cannabis sales or licenses, have some revenue, given that all towns will have to deal with the impacts of this proposal. Next slide, please. So this is the revenue estimate for the budget year and for fiscal 23, which would be the first full year of sales. We assume an April 22 start date for sales, so basically 1/4 of sales in the next fiscal year. I won't read every number on this chart, but total revenue would be around 10.8 million in the first year. The largest chunk of that is from fees, so fees from applications and licenses for this new market. And that equates to the local, the state, and the general fund shares you see in this table. Given that we only see a quarter of the year of sales, that 25% for state purposes is not enough to cover the startup costs for this proposal. So we anticipate allocating another $4.8 million in expenditures for these startup costs. So all that means that with the $6.5 million general fund share minus these startup costs, we estimate a $1.7 million general fund share in the first fiscal year. And then in the first full fiscal year, which would be fiscal 23 of sales, we think the general fund share will be around $17 million. Next slide, please. So this table summarizes the expenditure piece of the proposal. The largest share is for DBR, for the Office of Cannabis Regulation, and this is for inspection, enforcement staff, other staff needed to set up this market, and also a pretty sizable IT infrastructure investment to make sure that DBR has the IT tools needed to track and regulate this market. The second line there is funding for the tax division to ensure revenue collections and enforcement of taxation. And also, given that this is, not entirely, but largely a cash enterprise, we do anticipate receiving a lot of cash payments as tax payments, so some kind of one-time build-out costs to make sure that taxation can handle those cash payments. The third line there is state police funding. This would fund 3 new troopers in the traffic safety unit, and also would fund, as Director Tanner mentioned, about $500,000 for grants to local PDs for training and other needs around cannabis. The next 3 lines are $1 million of funding across the Health and Human Services agencies, so Health Department, BHDH, and EOHHS. This would fund some staff, a couple staff at Rhode for public health promotion and data, a couple staff at BHDH for program administration, and some initial startup funds for substance use disorder prevention and treatment programs, and then some money for UHHS for support public health data systems so we can accurately track the public health impacts and outcomes of this proposal. And finally, the investment in health equity would be $100,000 to each of the 11 health equity zones, which would be a total investment of $1.1 million in year 1. And likely, I think the health investments, both at Rhode, BHDH, and EOHHS, and also the HES investment would probably grow in the out years. So that's all I have.
Thank you, Matt. Just a question for you. If you're taking a look at your slide, and Director Tanner, if you maybe can put them back up, slides 10 and 11, can you walk me through between, on slide 11, we've got a $7.5 million expenditure estimate versus on slide 10, help me figure out where that fits into your overall numbers here?
Sure.
I see there's a state expenditure share, 2.7 million in fiscal 22 and 7.1 million in fiscal 23. But the next slide says fiscal 22, 7.5 million.
Yeah, so basically that,
Mr. Chair, which slide would you like to be on the screen?
Either slide 10 probably makes sense.
Okay, is that what you're viewing? Mm-hmm. Okay, great.
so hopefully if this math works out, that 7.5 million should be the sum of both the state expenditure share, which is the 25% allocation, and also the kind of one-time startup costs, which are the $4.8 million in that line. So again, given that we only realize, at most a quarter of a year of sales, there's just not enough money from a 25% share to fully fund the program needs in year one. So we anticipate a further $4.8 million, which would go to state expenditures, and that should add to that 7.5 number on slide 11.
Okay, that does add up. Then from that perspective on the detail on slide 11, do we know how this breaks down around what portion of this 7.5 that's itemized is the 4.8? Right, so what are the one-year expenses versus what are the things that you anticipate would be run rate?
Yeah, that's a question. We don't have a comprehensive kind of FY23 proposal at this time because we're focused on getting the FY22 numbers settled. I do think there's, I think DBR's IT needs would be, I think we booked like a little over $1 million in year one. I think that would be substantially less in year two, so in fiscal 23. After those startup costs for that program, I don't have an exact number for what the kind of ongoing maintenance cost might be for the IT system, but I assume it would be a lot less than the $1.2 million that we booked.
Okay.
Likewise, I think the taxation division had around $375,000 of this build-out cost to handle these cash payments. I assume that would not repeat in fiscal 23. So those are probably the two biggest examples of one-time costs in fiscal 23, 22 rather.
Okay.
But Mr. Chairman, we can get you a breakout of that after this hearing.
No, that,
Yeah, I mean, I will say that 4.8 million, that is not all startup one-time costs, right? That's just kind of an allocation to make sure that we have enough money to cover everything in year one, based on the fact that our 25% share is just too small, right? So I would not interpret that 4.8 million as one-time costs, just as extra money needed beyond the 25%, given that we will only see a few months of actual sales, which will, would feed into our state share.
Yep. No, that does make sense. I mean, especially since the total for fiscal 22 is 7.5, and then your expectation in fiscal 23 in a full year is an expense base of 7.1. So the assumption there would be likely that a lot of these costs would roll over. To Director Wilmer, to your point there, I think what would be helpful if you could provide back to us is of the fiscal 22 estimates, what are the one-times? And then in fiscal 23, what would that sort of expenditure breakdown look like?
Yep, we can do that.
Okay.
We'll do.
Thank you, Director. Are there questions from the committee?
I had a question.
Senator Casada.
I just had two questions, and one of them is I noticed that some of this money is going to go to the police departments, but I wanted to know how the police going to be able to know somebody's driving under the influence of marijuana. So far, we know when somebody's driving under the influence of alcohol. Is there going to be any part of this money going to be able to find out how the police department going to be working on that?
Matt, would you like to take that, or would you like me to?
I'm happy to. Good afternoon, Senator, and good afternoon, folks. Matt Santacruz from DBR here. I'm the Chief of the Office of Cannabis Regulation. You're exactly right, Senator. A large amount of that proposed spend in the public safety area is contemplated for investments in what's known as drug recognition expert, or DRE training, which is a admittedly emerging and a rapidly evolving field in law enforcement across the country. but certainly a need of our state and local law enforcement agencies that they perceive as adult use marijuana takes hold, not only here, but in other neighboring areas.
My next question is about education. Any of this fund is going to be able to go to allocate for educate young people, and we don't have the data yet, the damage about marijuana. But how are we going to be able to educate young people not to be starting using marijuana at such a young age? Are we going to allocate some money for that?
Yeah, absolutely. That's exactly what the allocations in BHDDH and to some extent RIDO are meant to supplement and meant to provide. We've got Deputy Secretary Novice from EOHHS who might speak a minute to that if she's available.
Yes, I am here. Thank you very much. Good afternoon, everyone. You are absolutely correct, Senator Quesada. It's part of the plan that both Department of Health, BHDDH, and EOHHS will work in partnership in terms of education, in terms of surveillance and data, so we better understand what's happening at the local level, and then supporting through the health equity zones also interventions at the local level. So education, outreach, treatment, prevention, all is that. That's why we are requesting the additional funding. So thank you.
Thank you.
Senator Acosta.
Thank you, Mr. Chairman, and thank you all for the presentation. I have a question that touches on, I guess, two related things, but if you could go back to slide 10, and I'll own my, part of the frame that I'm bringing in here is comparative for the different versions of this that we have going. But so in practice, at the point of sale, a customer would pay a 17% tax. Is that correct on the sale?
Yep, that's correct.
Right. So from there, when we get to the, oh, sorry, can you go to, was it slide 11 then? Sorry. So when we get to the distribution of those revenues, the current plan has it that some money would go based on volume, which leads to my question about licensing. And then some would be split evenly amongst all municipalities. What is the formula for calculating the volume-based allocation of the revenue? And how do you plan to do licensing in the first 3 years? Because there's somewhat of a perverse incentive to get in the game early because you're going to get a greater share of the revenues before the other municipalities can get in.
Yeah, it's a good question. I'll take the revenue allocation piece. Maybe other Matt can step in on the piece about licensing. So yeah, in terms of the local share, it is a three-part formula. So half of the local share would be split up by sales volume. So that would just be, what percentage of the whole in terms of retail sales were realized in your community. That would be half of the bucket of local sales, or local revenue share rather. And then the other part of that would be 1/4 would be based on license volume. I think we do count retail licenses higher in that formula. And then the last bucket, the last quarter would be this equal payment, which we think is around, $30,000 per year. So it would be kind of a three-part formula to split up that local 15% of all state revenue for this program.
Senator,
we'll talk about the first couple of years.
Yeah, and Senator Acosta, if I'm understanding your question correctly, it has to do with sort of how the licensing process will interact with geography.
Yeah, kind of. So, there's 25 licenses in year one. You can imagine a world in which there's 5 municipalities that get all 25. And so they have kind of quick access to 75% of the municipal share based on the way that we just described this breakdown, whereas the other municipalities will have to wait for subsequent years to get in to get a bigger share.
Yep. Yeah, that theory is correct. We intentionally did not overprescribe the sort of geographic breakdown of where these licenses are going to be under the theory that by and large, we'll let the market and we'll let the private firms in the industry sort of dictate where and when it's profitable to locate a license. So in that respect, you're correct. I'd also just note, too, though, that, these revenues are meant in part, at least to offset some of the costs that we know are going to come along with, the specific fact that a municipality is hosting a license. So while you're correct that they may be, disproportionately receiving this revenue share, particularly in the first year or two, it's also the case that some municipalities may be disproportionately bearing some of the costs, particularly with respect to public safety or infrastructure, that sort of thing. So it's a balance.
Thank you. Senator Rogers, I see is present. Would you like to be recorded in the affirmative on the votes missed? Senator Rogers? Yes, and I see Senator Raptakis is present. Would you like to be recorded in the affirmative on the hold for further
Yes, Madam
discussion?
Chair.
And Senator Archambault, I see that you're present. Would you like to be recorded in the affirmative?
Yes, Madam Chair, please.
Thank you. Senator Archambault, I believe that you, Senator Rogers?
Oh, I'm sorry. I finally figured out how to unmute this with the thing in the way. I guess I want to be as affirmative, and I do have a question moving forward for the board.
Yes, I believe Senator Archambault is next for a question, please.
Yeah, thank you, Madam Chair. Let me go back to Senator Quesada's question about marijuana and driving, and I know that Matt from the DBR gave a nice explanation of this, but I want to, as someone who spent his career I spent my career handling this stuff, either prosecuting it, defending it, arresting people for it. So when you're dealing with DUIs and alcohol, right, you have a certain amount of alcohol in your system. You can measure that in the field either with a test called a preliminary breath test, which isn't admissible in court, but it gives you a gauge, and then he also does these standardized field sobriety tests, and they're all handled by NHTSA. It's a national organization, traffic and safety, and they set the standard on it and what cops are trained with in the academy. And then, so if somebody's out in the field and they're driving and they're under the influence, it's a determination that's made based on a totality of factors that comes to a conclusion that this person is impaired. And so it's not illegal to drink and drive. It's legal to drink and be impaired and drive, right? So with alcohol, you have this really defined process, years of history. Marijuana, it's not that way. It has to still follow this methodology of impairment, but you can't test impairment with a breath test because, right, it's in the blood. So you have what Matt talked about as these drug recognition experts. And every police department has some that are trained on the specialized level of training to look at indicia, the eyes. There's this host of things that you have to, the nystagmus, all these different observations that have to be made to determine if somebody's impaired. And there are problems with it. Matt, you were very tactful in what you said about how we're working on it. It's not a really crystal clear area of law, and there are problems in the current statute dealing with impairment, juxtaposed with, put up against just having any level of the drug in your system, what they call per se laws, any level of it, and suddenly you're driving illegally, and that won't work with this whole host of marijuana laws that we're trying to pass. So I have a bill in that addresses that we passed in the past few years, and somebody on the House side has it. It eliminates the per se and focuses on impairment. So to get back to the Senator's question, I just wanted to amplify a little on what Matt had said. Whenever somebody's out in the field and you're driving, it's not going to be illegal to have marijuana in your system. What's going to be illegal is the same thing as alcohol if you're impaired, meaning you're driving over the double lane roadway, you're getting an accident, you're doing something that is out of the norm of driving, and then that gets investigated by the officer with a drug recognition expert if they're available, and there aren't a lot of those officers out there, and then the totality of that shows that the person's under the influence. Thanks.
Thank you, Senator. for the members of the committees, just know that we do have all the members that ask questions. We have the list, so we will go to you as soon as we can. Senator Seveny.
If we go back to that slide 11 where you had the numbers broken down, my particular interest in all of this is the substance abuse prevention, the prevention programs we have, the inadequacy with the funding for those existing programs. When I look at these numbers here on slide 11, for BHCDH, which basically manages the prevention program, I see, most of the money will go to some new FTEs. Treatment is hugely expensive. So what's left over for prevention? And how much of whatever is left over or is planned on an ongoing basis once the program, gets fully implemented? How much is going to go to prevention in general, and specifically, how much is going to go to the 8 regional prevention coalitions, which do most of the education, most of the outreach and data analysis related to the high school and middle school kids that obviously is going to be a concern as this unfolds. What about all that stuff related to prevention?
Yeah, I can jump in here. So you are correct that a good share of the BHH money in year one would go to supporting those couple of staff. I think there's maybe around $100,000 of grants and assistance beyond the staff cost. I mean, I think we do also anticipate some of the HES funding, and I'm happy to let Anna talk about this as well. HES funding would probably go to prevention and treatment services as well.
So thank you, Matt. You are absolutely correct. Part of the funding that is being supported in year one is to build the infrastructure. We expect in year 2 and beyond to increase the funding. That's what Matt was referring to when he said that the expenses will accrue. We want to be able to collect the data initially. That data is collected at the local level, as you said, absolutely correctly, by the prevention coalitions, but it's also supported by data collection at the Department of Health and at EOHHS, along with our partners. The health equity zones is the delivery of those prevention programs at the local level, working in partnership with the prevention coalitions. They've been working together for the past 3 to 4 years since we started dealing with drug overdose in Rhode Island. And we are using other federal funding sources to be able to counter and support and expand on some of the programs. We're not starting from scratch. This is building upon some of our existing programs.
Okay, I still didn't hear any particular numbers or percentages that's going to go specifically to prevention. I mean, part of my concern with all this is there is almost no state money invested in the prevention side of this problem. Most of it goes to administrative staff, to the programmatic costs at the departments, and then the treatment programs. Hell, we spend a ton of money driving people around to appointments. None of this money gets to the prevention coalitions. None of it gets to the ground level working groups that are interacting with the children. There's very little that goes to the student assistance counseling program. To have counselors on the ground with the kids in the schools. I'm not hearing anything on how we're going to fix this.
So that's from the BHDDH, half of that funding is going in fact towards the assistance program. That's 200, I believe, that is going towards that. We can give you the specific number. The 1.1 million for the health equity zones, it's all towards prevention. None of it is towards infrastructure. It's focusing, the infrastructure has already been built, and the Department of Health is supporting that with other fundings. That is prevention money, that $1 million that you're seeing in there. And goes specifically towards the community-based organizations.
of that health equity zone, 1.1 million, is going to the prevention coalitions?
It's all community-based organizations that are focusing on prevention, yes.
Yeah, I would love to see a breakout on how much these various organizations are going to get and what specifically they're going to do. I asked that having a pretty fair idea what the prevention coalitions do, that I've found over the years to be pretty effective, principally with our school-age children, which is what my great concern is. An adult can make their own choices and decide what they want to do, but kids, I mean, I think we can all agree that if we get this right, perhaps this program will do no real harm, but that's the best we could expect. And probably the more practical expectation is this is going to hinder our ability and our progress made with substance abuse issues in our young children.
No, absolutely. I can assure you that funding is going directly to prevention activities. I can give you the breakdown and send you all of the community-based organizations that are working right now and what they will be doing. I also want to assure you, as you know, there is all of the new funding that the state is going to be receiving through the American Recovery Act. The prevention coalitions are going to be supported through that funding too. And so we are not expecting a shortage of funding in this year, in this first year, that will be able to address that. We will be asking for more funding going forward in the outward years when we don't have all of the funding that we absolutely wouldn't be needing. For us, BHDDH, RIDO, EOHHS agencies, I want to assure you, the prevention is absolutely critical, a focus on young children, on adolescents, on pregnant women, working at the community level. It's a key component of what needs to happen, and the agencies are committed to invest the necessary resources directly on the community. It's also what the commission will be doing.
Thank you, Madam Secretary.
I appreciate that. If you'd write all that down, I'd love to see it on paper.
Yeah.
Absolutely.
So
Me too.
thank you, Senator Seveny, and I was going to just jump in there, Madam Secretary. I agree with Senator Seveny. If you could provide both Senator Seveny and our fiscal staff a breakdown of the funding that you're proposing through this, plus also how you see the American Rescue Plan money working in the next few years, but more importantly, if we are relying on any of that funding, what the backside of that is once that funding expires as well, and how that intertwines with this proposal. That'd be really good for us to get into the details and make sure that we understand.
Chair Griffin, I would like to get involved on that too, please.
And
We
please,
will send it coordinated through, we will definitely coordinate it through Jonathan's and DBR's office.
awesome.
Thank you.
Thank you so much. Senator Aptakis.
Thank you, Mr. Chairman. I'm looking at the numbers on slide 10. Is that the estimated total number? That's the revenue, but what is the sales? I'm looking at these numbers, they're kind of small. When I looked at Massachusetts for October of 2020, their, I think, sales were 75 million. If I look at Colorado, for the first year that they had the program, their 5 million population versus 1 million, they were around 683 million. What is our total sales estimated at? I know the revenue is different from sales, but what are we anticipating for sales? Number one.
That's a good question. So we anticipate for a full year of sales to be around $95 million of retail sales.
95 million total.
Correct.
Okay. Because I'm looking at Massachusetts, they seem a little bit higher, but they were first out of the block. My second question, my concern is what Senator Quesada had said earlier. We're going to have DUI, now we're probably going to have MUI, marijuana under the influence. I'm just kind of cautious of what the costs are going to be upon the courts as more and more folks are arrested for marijuana use and probably alcohol use. Are we looking at generating or having more of this money go toward the courts? And also, I think we've got some major issues with the laws that we have currently in statute. I think if we make marijuana legal in Rhode Island, we're going to have to get even tougher, more tougher on anyone using marijuana and driving as far as being inebriated. So I think that's a serious issue that if we do pass this legislation, we're gonna have to look at the statutes and make it a lot easier for law enforcement to charge and the judiciary to make sure that those folks that do get behind the wheel and using marijuana at the same time could be drinking alcohol, being impaired, that the penalties should be a lot stricter. And that would be a strong warning as far as education. Thank you.
Would anyone from the administration like to discuss I know you have enforcement money in Department of Public Safety. Would you like to care of giving any color as to what that expenditure is?
Sure, I'd be happy to. Matt Santa Cruz. Just to sort of echo Senator Raptakis' good point. What we hear from folks in law enforcement all the time is, this is already here in the state of Rhode Island, and they need the resources to deal with it. We've got Massachusetts growing by the month. We've got Connecticut about to come online, New York and New Jersey right behind them, and a medical program that's got 19,000 patients registered and several hundred caregivers as well. So marijuana is not, as you all very well know, has not stayed outside of Rhode Island's borders, and particularly as a drive-through state for a lot of folks on either side of us. State and local law enforcement already dealing with this, and so what we've hoped to accomplish with this proposal is understanding that we may see at the very least a marginal uptick in overall marijuana consumption, if not changing patterns in overall marijuana consumption, making hopefully a meaningful down payment at both the state and local levels, and building out capacity and training and staff to give our local law enforcement and state law enforcement agencies the tools that they need to deal with this on the roadways. On the sort of court implementation side and implementation cost side, it's a good point. It's one we haven't explored in depth. We've been sort of focused what happens out there, in the field. We'd welcome a conversation with you, Senator Raptakis, and with our partners in the judiciary branch and potentially in the AG's office on what additional either resources or programming might be necessary to deal with the downstream consequences of what we're talking about here.
So lastly, real quickly, Mr. Chairman, what I'm looking at is if these upticks occur with both the marijuana increasing, I think the legislation should allow that law enforcement and the courts have more funding available, make that streamline a lot easier for the courts to access the estimated revenue. That's only my concern, that while we're increasing, we're looking at, I believe on one of the slides, it said about $500,000 to law enforcement, state police, around 3 troopers, and then some additional funding going to other cities, towns. But I want to make it easier in the legislation. If the courts are saying, look, we need more revenue to tackle all these cases coming into the court, and if law enforcement says we need more revenue to tackle the problem out in the streets, I don't want to cut them, shortchange them. So while we're moving forward, I hope there's a mechanism that when they do ask the ask, that revenue is going to be waiting for them. That's my serious concern that I have, and thank you.
Thank you, Senator Raptakis, and will definitely be something we'll be looking at. Senator Khanna.
Thank you, Mr. Chairman. I have a question in regards to licenses and the equitable access that you explained to us in terms of the MBEs. I would like to know about the woman business enterprise being included into the MBE applicants lottery. How are you ensuring that the women that are getting this retail license are not only going to be taking all of the applications and they're only going to be, like, for example, white women? So can you explain to us the lottery process when it comes to the equitable access to these licenses?
Sorry about that. Happy to. We, I think at a high level, we're hopeful to balance equity with access. And what I mean by that is true access and an attempt to really build an inclusive, diverse, and equitable cannabis industry in our state quickly. And so what we decided to do is to lean, as you'll see in the proposal, very heavily on the existing framework that's been around for years and years in the state of Rhode Island, that dictates the sort of rules and regs and process around qualifying as a minority or women-owned business, what we call shorthand MBE, through our ODEO and DOA, and that's previously existed obviously for state contracting, but it's a useful framework and one that is known and that has already a well built out set of rules and regs and administrative procedure around it, rather starting from sort of ground up and from scratch, which could not only result in significant bureaucratic delays, but we've seen in other states that have tried to do this in very well-intentioned ways, very real litigation risk from various folks. So as we were thinking through, the ways that we can build this out and build out the licensing structure, it became, clear to us that this might be a good idea is to leverage the existing framework. So to, directly answer your question, we don't have, a guarantee built in that a qualifying business for the purposes of this sort of first tier of the lottery that's owned by a woman will not be owned by a white woman. We cannot guarantee that. The rules and regs as they're presently written in the statute don't guarantee that. And so that kind of, that's plainly the case. And it's something we kind of went in with knowing. What I will say, just sort of on the ground experience, we have almost 70 licensed cultivators in the state of Rhode Island right now and 3 licensed compassion centers. One of those licensees out of that, 70 plus is currently owned by a woman. And so we have an access issue and an equity issue, certainly among racial and ethnic and geographic lines, no question about it. We also have an equity and access issue around gender lines as well. And as we seek to, grow a diverse and inclusive industry here in several respects, it's something that we think, ought to be part of the puzzle.
Thank you, Matt, for the clarification. And by no means I take that you shouldn't give it to a white woman. What I'm trying to say is that when you build it into having 5 applicants for year 1, for year 2, and year 3 out of the 25 retail licenses, what I mean was that why not thinking maybe having 2 categories, one for minority business enterprise and the other one for the woman business enterprise, instead of including them both in only one category. That was really maybe what I was going with the question. Instead of just saying, I think access and equitable access needs to happen for both, right? Minority business enterprise and women business enterprise. So it was just a question of why not building in a way to separate both, maybe the minority business enterprise and the woman business enterprise with the licenses that you're thinking. I'm very happy to see that there is an equitable access, but I think we could do a little better and just separate the two just to make sure and ensure that more people have the opportunity. With that, I also want to ask about the lottery process. How are you doing the lottery process? Is this going to be an open process? Is this going to be something where you're literally doing like the lottery by taking it out? Like how does that consist of? Could you explain a little bit about that?
Yeah, happy to. And I should say, at a high level, we feel strongly that awarding these licenses by way of a lottery is really the highest and best way to ensure fairness and transparency and accountability, like across the board. So having said that, the way it'll work sort of generally is similar to the way, we're currently going about awarding the 6 new compassion center licenses, with one important exception. And that is to say, we will have an open application period. Well, first we'll promulgate, obviously what'll probably be lengthy regulations around, what these businesses need to look like and what the applicants need to, be able to show us. After that, those rules and regs are promulgated, which will probably take, between 6 and 7 months. We'll have an open application period of probably in the neighborhood of 90 days. That'll close. We'll then spend some time, obviously, evaluating the applications for things like completeness, accuracy, just like really baseline, bare minimum. Do you meet the standards? Do you meet the letter of the rules and regs? Are you qualified? Which is a very objective assessment, intentionally. And then what we'll do is we'll basically put into a hat the applicants that have proven or have come to us with like a determination that they're a qualified minority-owned business or woman-owned business per ODEO's regs. The first 5 licenses will be pulled out of that hat of the qualifying MBE applicants. The balance of those licenses, which is to say the remaining 20, will be pulled out of a hat of just general applicants, irrespective of MBE status or not. So to reiterate, and that'll be that year's kind of 25, the 5 MBEs and the 20 general applicants. And we're going to do the 5 MBEs first. That'll probably, we haven't quite figured out what the timing will be, and that'll be pursuant to our rules and regs and what the statute ultimately says. We want to give those 5 minority or women-owned business applicants sort of first crack at the license, and then we'll go from those 5 into the 20 sort of general applicant pool. That's how it'll work at a high level.
Thank you so much, Matt. Thank you, Mr. Chairman.
Thank you, Senator. Senator Palma.
Thank you, Mr. Chairman. Just a quick follow-up to Matt, and then I have a question to Secretary No Vice after that. Matt is somewhere. I don't see Matt, but that's okay. So Matt, there you are. Based on the answer you just gave and the number per year, so we've been walking this journey for I don't know how many years now on the medical side of things. And I've been respectfully direct before, and I'll be respectfully direct now. We've never had a plan, I'm assuming we have a plan now, that looked at things really over a multi-year period that held water. Why do we believe the plan we have, if we just think about what we did every year was something new, something different, a new twist or a new variation on a theme, why is this one the right one? And what have you looked at to ensure it's the right one?
It's a great question. I'm happy to answer it. So what we've really done or hope to accomplish with this proposal is lay out a 3-year vision for what we're really thinking is phase 1 of adult use marijuana in Rhode Island. And what we try to lay out in the story we're trying to tell about that 3-year vision is, we're going to start off for the first 3 years, every year with 25 licenses. We'll make those licenses available. It doesn't mean that they're necessarily going to go out the door, under the theory that if we turn around at the end of year 2 and the market has decided and industry participants have decided that, there's 45 licenses already out there, or there are 50 licenses already out there and it's no longer profitable for us to enter the market, that'll be a signal to us as regulators that we've kind of hit market saturation and we'll make sort of changes accordingly. But assuming that folks are going to sort of go after each round of 25 licenses, we turn around at the end of the 3rd year of implementation, we've got 75 retail licenses up and running in the state of Rhode Island. That comes out to about 7 to 7.5 licenses per 100,000 Rhode Islanders, which is about what we've seen in mature adult use states at year 3 of implementation as kind of a benchmark and kind of a reasonable aim to shoot for as a market develops and as a market stands up. So we've tried to take, and then at the end of that 3rd year, before making any new licenses available in years 4 and onward, the statute requires DBR and OMB to get together and conduct a rigorous market study that will allow us to then and only then make new licenses available should it be determined that the market can bear it and that public health and safety are not at risk. So we've tried to take this, year by year for 3 years with a vision at where we want to end up at the end of year 3 that protects public health and safety.
Matt, thank you. And I think the evaluation, the comparison to other mature states that have done that is very good. The concern I have is there's going to be some businesses out there, because this is a business, right? Where that's what we're looking at. This is business. It's a tax. It's a revenue. That's why it's in the budget ultimately. But it's the piece that we're going to have potential businesses out there looking to get a piece of the pie or participate in this, and they're going to have an expectation of what might come in the future. So thanks for thinking about it. So, Mr. Chairman, I just have one follow-up question to Secretary Novice with regards to a follow back on Senator 70's question with regards to substance abuse prevention coalition, etc. I guess I was surprised to see the HES listed here. The Prevention Coalition has been around longer than the HES have. The Prevention Coalitions, and we have them in all of our districts, and I think we all know them well. We probably have phone calls from all of them in all of our districts. They really get it. They've been doing this a long time, probably for 15 or so years, maybe longer, maybe probably 20 years now. I think the Prevention Coalition do it. They had different names in the past. Let's put the HES stuff aside for a second, because that's a lot of money. I'm not certain what the HESs are doing these days with regards to the money they are getting. I'm sure it's good stuff. We need to figure that out. But I'd encourage you the money that comes in for prevention goes to Prevention Coalitions. The HESs should be a part of it. Prevention Coalitions, that's what they do on a day-to-day basis. That's where it should go. One just a comment back from Senator Chairman Pearson's comment. Back and request back to you with regards to Senator 70's. I know you mentioned the rescue plan money and the CARES money and all that, but that's one-time money. We should never be looking at using one-time money for anything that needs to progress year after year after year after year after year. This needs to be something that the agency, the Secretariat, stands behind. And Senator 70's been a champion on this for I don't know how many years now. But the Secretariat and the Secretary stands behind this, puts the money in there from a budget perspective, not the one-time money. Because Chairman Pearson asked, 3 years from now, we're going to do what? And someone's going to say, what was governor at the time? Nope, we don't have it anymore. It's going to be cut. So just a comment, you don't need to answer. I just ask you to take that under advice. Thank you, Chairman.
Absolutely. If you allow me 1 quick minute to respond. We are absolutely going to be putting the money. When I refer to the rescue plan, it's recognizing that the revenue that we're going to get from the legalization of adult use marijuana is not going to be the same year per year. So in this year one, because we know the revenue is going to be limited, we want to make sure, recognizing absolutely the importance of prevention, that we identify other funding streams that can help us from the get-go respond and address from a prevention perspective and put the resources where they need to be. That's what we expect to do. As the revenue increases, I think we said it from also, that's what Matt was referring to. The request will increase and will expand as the revenue increases. We absolutely recognize the nature of a once in a lifetime that those the rescue plan is, but that's how we were planning on using it. Now that we don't have the fund, and once that fund revenue increases with the adult marijuana, we will be able to increase our investments in prevention. So we are in the same page with you and definitely work with you on making those allocations.
Thank you, Secretary. Thank you, Chairman.
Thank you, Senator, and thank you, Madam Secretary. Senator Rogers.
Thank you, Chair. I've got several questions. A lot of my colleagues have been involved with this through the medical marijuana, so I'm pretty much new. I wasn't involved in that, this being my second term. I know we addressed the abuse and public safety aspect of it, but I want to roll it back to get on the revenue equity sharing train with the municipalities, for the sake of a better word. Question is, and I've looked in how other states run it, which works and which don't work. Now, we're going to have a tax on at the point of sale through what we call dispensaries at 17%. Now, my question is, the other part of that, the dispensaries can't dispense nothing unless it's grown by the growers. Now, I live in rural communities, my district, so chances are a lot of these growers are going to be in the rural community. So as these growers grow it, it's part of the process at the dispensary. Are they going to be fairly compensated through this sale as part of that for their hosting the growers? Because what I see, if that really doesn't happen, and coming from municipal, I can tell you exactly what might happen. If they don't think they're getting a fair share in hosting the growers, they're going to be very restrictive with a hammer on zoning. And that's going to be a very, very difficult thing to challenge. So that leads me to my next question is, are the product going to be allowed to come in from out of state, or is it going to be the product has to come from within the state, which is a help to us and local businesses and farmers? And then I lead that down the line. One or two of the states that have done pretty good with this. Is there going to be a separation between the growers and the dispensaries? Yes or no? And then has anybody thought of, actually I think that's a good idea, separating the growers from the dispensers. But I had brought this up before when this started percolating in my first year about legalizing marijuana. And the studies that I did, it's a very wise thing to have a third component between the growers and the dispensaries, and that's a centralized distribution hub where everything comes in, whether it's from growers, everything into a distribution center as an oversight to cross-reference checks and balances from the dispensaries, whether it be a health issue from a product that came in from a specific grower that can be isolated, whether through the health department and testing, cross-check balances on revenue where you have checks and balances on your taxes where DBR can go in and check that at Department of Administration. So those are just a couple questions that I had, and I don't know, quite a bit there to unravel, but those are what I had. So.
Yeah, those are great questions. Let me take them. Let me try and take them one at a time. So on the question of hosting cultivators, it's a great point, and it's a good opportunity to make a couple of points with respect to the Governor McKee's proposal on cultivation. And I want to say this very clearly: we are not anticipating any new cultivator licenses or cultivator capacity in the first at least 3 years of adult use implementation. So what we've got out there in the state of Rhode Island right now in terms of our 63 or so licensed cultivators is, as we see it, more than enough to service the need and the market demand in the first 3 years of adult use implementation. And we plan on moving forward in that respect. In terms of where the cultivators actually sort of host themselves or site themselves, we've had actually an interesting pattern of a disproportionate number of these folks, really because we don't allow outdoor grow in Rhode Island for good reasons, locating in industrial zones. And these are really heavily sort of concentrated in Warwick, in parts of Cranston, and in other sort of industrial areas in the state of Rhode Island. We've got a few that are in, Richmond, Hopkinton, Exeter, and places in South County. And by and large, we've had very successful and productive relationships between our licensed cultivators and their local government partners, not only in planning and zoning departments and zoning boards, but also fire marshals and that sort of thing. So we feel comfortable with what we've got grooving along right now in terms of our licensed cultivators and their local government partners. And we plan on keeping that moving forward, at least for the first 3 years. But your points are extremely well taken and absolutely correct.
Right.
Sorry, go ahead.
I was just wondering if I could, before we get too far down the line on that one. So back to my question, that does answer where they are, and they're not going to be any more. But on the revenue sharing of, again, I said it's all being done on the dispensary end. That's calculated to the host town. But, for example, you have just mentioned Hopkinton, Richmond, and Exeter. I don't think there's any dispensaries out there, but they host the growers. And are they being compensated in them communities more than, let's say, a town of Coventry that doesn't have any growers or dispensaries because they host it? You kind of skipped over that. That was part of that question.
Great.
Yeah, and Matt, I can jump in here if you want on this question, or if you want to answer it, that's fine too.
Well, I would just say to the senator, it's a great point. We typically, the way we're kind of thinking about the way the local revenue shares would break down. The theory there is that the retail activity is really the activity that's going to present the highest cost to the town. But these are, go ahead.
Again, when growers do move into communities like that, it does raise a lot of eyebrows and it does raise a lot of concerns. And this leads me back to the final thing I said. They'll be zoned out if they don't get part of the equity train as being host growers in their communities. And that was my point. It seems like the people that benefited the most of the dispensaries, but without the growers, you can't have a dispensary. And I don't think they're barely being compensated for at least being hosting communities more so than communities that don't host either.
Yeah, that's a good point. This is Matt McKay from OMB. So our local revenue share, we do divide it into 3 buckets, right? So one bucket is based on retail sales. That's half of the local share. 1/4 is based on license volume in that community. So that's an attempt to realize that, there are impacts for locating cultivation, testing, all these other license categories. Beyond sales, there are impacts for those license categories, to your point, Senator. So we will allocate 1/4 of local revenue share to those based on license volume per community. Then that last 1/4 is based on just an equal payment to every city and town.
And to my next question, oversight, is there going to be a centralized distribution where all these entities can isolate health problems, whether it's a bad batch or something that's creating a health issue? It's kind of, to me, it's a smart thing between the growers and the dispensaries to have a distribution center that you have oversight, whether it's through revenue, like say some products coming in, and it keeps people honest because there's a check and balance in the middle, whether it be through health or taxation or anything else. I think that's an important part that I don't see in this. I didn't know if that was brought up.
It's a great point, and we don't contemplate the creation of like a physical distribution or sort of warehouse entity the way I think you might be alluding to. But the intent is exactly right and is exactly the reason we've included a substantial investment in a new and improved seed to sale tracking system that'll equip the entire administration to better track exactly what's happening with every product that's ending up on a shelf. That'll track it through the testing process, through our licensed laboratories, and with the support of our partners at Rhode, and ultimately, provide us with the toolkit that we need to effectively regulate and oversee this marketplace. So while we're not obviously creating a centralized distribution hub, and certainly not one that's run by the government, we do absolutely, in the spirit of what you're talking about, anticipate adding the tools in the toolbox we need to accomplish what you're talking about.
Just one other point on that. I didn't in any way implement it would be a government one. I would rather see it be a private one. But I think the cost of seed to sale and the oversight is a lot more detailed and maybe more cost prohibitive versus a simple distribution center where everything's checked in, checked out. I think it'd be a little smarter to look at that. And I'm not the expert on it, but it seems to me it'd be a little bit better oversight and be done by a private company that's completely separate, where you do have checks and balances that you can immediately stop and find something and address it. So that's all I had.
Thank you so much, Senator. Senator Quesada.
Thank you, Mr. Chair. My question go back to what Senator Cano was talking about, but I just want to be more bold. I get a lot of concern, especially from the community of color. The community of color was the one who paid most of the price and cancellation, being in jail because of selling marijuana in the past. And some of them are concerned, especially when they put this cake together, how much of this license is going to be ending in people of color, especially in the community of like Providence, Woonsocket, Central Falls, Pawtucket, where they don't feel they are connected. And when I'm talking about connected, they don't know people in the in the political way, then maybe they're not going to be able to have the money that they're going to be required to get a license and things like that. What are they planning to do to help community of color to be able, especially 25 license a year? I don't think it's a lot, but how many of that license do you think is going to end in the community of color? That's my question.
So, I'd refer back to the 5 out of 25, and we see that really hopefully as a floor and not a ceiling. There's nothing precluding, folks who are either, minority or majority owners of a cannabis company or prospective licensee from entering the general application pool. So it's certainly the case that we may have 5 minority-owned businesses picked first each year, and then potentially another 2 or 3 picked out of the hat in the remaining 20. So I think that's the way we hopefully see this kind of coming back in the first 3 years of the program. To your point around sort of capital access, it's a really good one, and it's one that every state that's done this has struggled with. Because frankly, as you very well know, Senator, this is an issue that's in no way exclusive to the cannabis industry. Small business access to capital for minority and women-owned businesses, particularly in our high-density communities, has been an issue, has been made way worse by the pandemic in numerous respects, and it's something that all of state government right now is working hard on. We tried to reflect that fact in particularly in not only the licensing structure, but in what we're hoping is a substantial back-end investment through the governor's cannabis reinvestment task force that's set up elsewhere in the budget article, that's charged specifically with working with community-based organizations, CDCs, commerce, and folks who are really on the ground in these communities with making recommendations for enhanced small business capital access across the board, with a specific eye to racial and ethnic equity and the disproportionately felt impact of the pandemic. So, we don't have a perfect solution to that problem in our budget article. What I would hope that we've done is clearly recognize its importance and made a good faith signal that we're going to keep working on it as this program takes shape and as it rolls out.
Thank you.
This is Pam Toro. I just wanted to add to what Matt indicated that also Article 11 does include a provision for ancillary licenses. What we found is that nationwide, this is an area where with low capital investment, people can get involved in the cannabis industry. It also attracts a very diverse group of folks because of the creativity involved. And that has, I believe, the set aside for that for MBEs is 50% in terms of those licenses. So I think that adds to the MBE that we have on the retail license side.
Thank you so much.
Thank you. Thank you, Mr. Chair.
Thank you, Senator. Senator Acosta.
Thank you, Chairman, and thank you, Matt, for some of the ways that you've addressed the concerns of my colleagues who maybe don't necessarily fully acknowledge how long this has been around and that we've used this. And something about this article is that I feel, despite what the comments have been made so far, it does a lot thinking about the future, but does very little acknowledging the past. And, we'd be remiss not to acknowledge that most of us grew up in the generation or the generation right before or the generation right after we socially decided that consuming cannabis was a crime and criminalizing it and harshly punishing people who used it, despite the fact that cannabis users come from all stripes. They look very different. They come from all sorts of socioeconomic classes. And yet the way that we executed the criminalization of cannabis after being told it was wrong and it was bad and the people who used it are bad was disproportionately against poor people and black and brown people. And so I find that it's a glaring omission that this article does not talk about expungement. for something that will now no longer be considered a crime. And so I'd be very interested in what the governor's administration has to say about this, because unless we have plans to address this through some other route, I think it is completely unfair to the people from the past, many of whom are still suffering the consequences of the way that we treated something, to go forward with this article as written.
Fully agree, Senator. This Article 11, was focused like a laser on building and implementing equitable and efficient and transparent adult use cannabis industry and regulatory structure here in the state of Rhode Island. Having said that, this governor and this administration fully supports what you're talking about, fully supports other legislative proposals moving through the process right now that would accomplish expungement, and as a policy issue, fully appreciates the importance of it, and we're working hard as an administration and as a team to help move those things forward, and to particularly move them forward through the implementation phase to the extent that we can, because they're perfectly complementary. What we're talking about here, by way of building a diverse and inclusive and forward-looking cannabis industry, works hand in hand with the proposals that are moving along right now, and that we're very happy to see reflected in the Senate's proposal to address the harms of the past that have been disproportionately felt by certain communities, certain populations, and indeed certain families and social groups. So let me just say forcefully on behalf of the administration and the governor, we support exactly what you're talking about, and stand ready to do whatever we can to help it happen.
Thank you, Matt, and thank you, Senator Acosta. Senator Archambault.
Yeah, thank you, Mr. Chairman. First and foremost, I want to respond to what Senator Acosta just brought up. I think he's spot on this. Anybody who was given a sentence and criminalized for marijuana that would have been under simple possession, clearly not intent to deliver, that's a felony. That's a whole different category. That's not the person you want to have the expungement. But if it's anybody who had simple possession of marijuana, whether it was for a filing, probation, or a suspended sentence, we can look backwards with some simple legislation. There's a simple fix to this. And there are a couple of bills in that attempt to do this. If we look at it carefully with the rest of the session, we could dovetail the thing into this bulk of legislation and take care of that body of people. I'll never forget, somebody testified years back in judiciary about a conviction for marijuana that made them ineligible for a complete expungement of their record, and years had passed. And this guy became a pastor, and now it had been decades, and he could never get it off his records. He had a felony, but it was the marijuana that threw him into a tailspin. Anyway, that's fixable. We can clean that up. But I want to go back quickly to what Senator Raptakis brought up about the drug recognition experts again, and making sure that law enforcement and the courts are adequately funded. I want to sort of simplify this if I can. Look, it's not illegal to take drugs and drive, right? It's illegal to be impaired and drive. Now, some out there are saying, yes, it is. Yes, it is. The statute's per se. Well, we're passing a statute that's going to clean that up so that the marijuana laws will work in conjunction with it. Otherwise, per se, and if you know what I mean by per se, that means if you have any limit in your system at all, you can't drive. So anybody who's under prescriptive medicine, right, that falls into the schedules, you couldn't drive. And that's clearly not where we want to go with policy that deals with impairment. It's based on impairment. So if you smoke marijuana and you're impaired driving your car, you shouldn't be on the road. And if you get stopped and the law enforcement runs you through a battery of tests based on a drug recognition expert, which is where the funding needs to go, you're going to get arrested, right? And over 20 years, I've handled a ton of these. As a defense attorney, and I prosecuted for a long time now. 14 years, 3 towns. I've got a couple of active marijuana cases now that I'm prosecuting. They're not the easiest thing to prove. You look at impairment, and impairment means that the person was either driving over the double-lane roadway or they got in an accident. There's a host of factors, as I said earlier. I don't want to be redundant here. I don't think we need to fixate there. A drug is a drug. If you're driving and you're impaired, you shouldn't be on the road. You're going to get arrested and get taken off the road and processed like anybody else. I don't think we need to reinvent the wheel on that. And I do think it's important to focus on the fact that law enforcement does need more drug recognition experts because it's all we have. We don't have anything other than drug recognition experts, right, Matt? I mean, and that's questionable science. Quite frankly, I'm not undermining the men and women who go through the program. It's like taking an EMT class. It's very intensive. But is it scientifically reliable in our courts under Fry and Daubert? Not really. And if you've got a good defense attorney, you can knock it out because it's not really the drug recognition expert's not a medical doctor. So they're making an assessment that if they're challenged scientifically by a defense attorney with enough money behind the whole expert process, it's going to get thrown out. What's important to understand is that we need to work with what we have. Law enforcement needs more drug recognition experts. Some of that money's already being earmarked that way. If every town had a drug recognition expert, at least it would help to make a determination if somebody's under the influence in a situation where without that drug recognition expert, you don't have a case, all right, other than the person going and having a blood draw, and they could always refuse. You can refuse to take the blood draw, and now where are you, right? Might be a fatal case, God forbid. You want that evidence. So drug recognition experts through law enforcement, they play an important role. It's the best we have right now. We should have them. As for the courts, I will say to Senator Aptakis that I don't think we're going to see a huge uptick in this at all. I think that you're just going to continue to see a steady stream of DUIs regarding marijuana and alcohol, and there always have been DUIs with marijuana, and as I said earlier, so, in terms of the funding, well, we make sure we've got enough drug recognition experts. I think we're doing the right thing, and the rest of it will just follow. Remember, it's not illegal to have it. It's illegal to be impaired. Thank you.
Thank you, Senator. Senator Chacon.
Yes, thank you, Mr. Chairman. I have a question pertaining to the present licensed cultivators and all of the individuals that are on their applications. Does the department cross-check those individuals with the home growers to see if there's an overlap? Someone from DBR?
You're asking if we currently allow people on cultivation licenses to be registered tag holders under the medical program?
Have you checked to see if there are any? Correct.
Okay. Cam, can you jump in here?
Sure. So as part of licensure of the existing cultivators, they do fill out a disclosure form. Part of that process is if they are a caregiver, they have to turn in their caregiver registration and the related grow. There is not a prohibition, though, as to patient status for folks who are cultivators, because it's obviously a medical program and this is medicine for them. In terms of, if you're speaking of unlawful grows, that we do work closely with. Obviously, if it's an unlawful grow, they do not have tags and they do not have a registration. But we do work very closely with the state police and with local law enforcement, so that if they have an issue in a city or town, they can contact us and we can check to see if they do have tags registered. And if they don't, we work cooperatively with them on the law enforcement aspect.
So just a follow-up. So if I were a partner or an individual that's affiliated with a cultivation center, after the application was approved, then I could come back and also apply as a home grow, and the department would never check, correct?
If you registered as a caregiver and got tags as a caregiver as part of the annual renewal process, that would be picked up. Additionally, there is an obligation to update those Form 2s. So if someone who's part of a licensed cultivation decides for whatever reason they'd like to become a caregiver and would want to grow, that would present the issue that they need to decide. Do they want to extricate themselves from the cultivation and no longer be part of the license program and pursue the caregiver license? We do have some people come and go from these businesses.
Right, so there is some type of a cross-check.
Yes.
Okay, thank you.
Thank you, Senator Chacon. I do believe that does conclude the questions from members, but if any member does have a question that I maybe missed, please indicate now. Okay. Hearing none, I want to thank the administration for being with us this evening and presenting Article 11 and for answering the questions from committee members on both committees. We are going to temporarily pause our hearing on Article 11. We do have individuals signed to testify, but we're going to proceed to hear Senate Bill 568 and the other bills on the agenda that are of a similar matter, and then we will return back to receive testimony on all of the bills at once. And so with that, I will turn it over to Chairwoman Coyne to begin hearing Senate Bill 568.
Thank you, Chair Pearson. Yes, we have 5 bills up for judiciary hearing this evening. The first will be 568. What we'll do is we'll hear from the sponsors on each of the 5 bills. And after we hear from the sponsor on the bill, then we'll take questions from committee members. And then we'll go to the next bill, which will be Senate Bill 192 and so forth. So beginning with Senate Bill number 568 by Chair Miller and Leader McCaffrey are both here to present on this bill this evening. I know you both worked very, very hard and long on this bill. So we're ready to hear your explanation of the bill. And welcome to the committee.
Thank you for having us. As most of you know, earlier this session, the Senate President asked myself and the leader to work with staff on developing legislation around the legalization of recreational sale of marijuana. And I first want to thank our staff, especially Jake Basalian, who worked on an almost daily basis amongst his other duties to help us draft this legislation. But it goes back much further than that. In March of 2010, the Senate released a report on the prohibition of marijuana, and the staff on that was Kelly Mahoney and Steve Iannazzi. That would have been, we would have started the hearings in 2009 on that. And to give you an example, it was had 11 or 12 member commission that included Jerome Smith, father of Senator Murray, and David Lewis, who was very important to the commission and has recently passed, who was the director of Brown University of addiction research. So it was very thought out and led to the decriminalization of marijuana. Getting back to Senate Bill 568, we do, based on the hearing we just heard, the understanding and expectation and the ambition of the Senate, and I believe also the legislature and the governor's office, is that we get to, or as close as we can get to, one version of this legislation that is similar or as close as we can get to the budget article. And so we will have, lengthy discussions that hopefully lead to that, but people should understand that's the ambition. But this bill legalizes the possession of up to 1 ounce of cannabis for Rhode Islanders age 21 or over, establishes if we can go to the first slide, establishes a comprehensive regulatory structure similar to Massachusetts that will be overseen by a 5-member Cannabis Control Commission and its supporting staff. Recreational cannabis use would be taxed at the retail point of sale at the total rate of 20%, which is also identical and very similar to the Massachusetts tax structure. Legislation aims to redress wrongs perpetuated by a policy of prohibition and the war on drugs, and the realities of consumption in legalized regulated states and that are nearby that have, like Massachusetts, or soon will have, legalize recreational sale of cannabis. Massachusetts, New York, New Jersey. New York just was signed by the governor yesterday, I think. And New Jersey was voted by the referendum, and Connecticut also. So Rhode Island is seeing the repercussions of those marketplaces without the revenue, which is an important, overreaching point.
At this point, I like Josh, would like to thank the staff here as well as Jake. He put yeoman's hours into coming up with this draft product that we have before us today. The question we're faced with, why now? Now is the time to do this. The reality of the situation is, for the last number of years, we've had cannabis available through the illicit market in the state of Rhode Island and through the markets of other states that have legalized the marijuana, so we should capitalize on it now. We have Massachusetts, our sister state, that has opened up to legalization of cannabis, and we look at it as we're trying to address the concerns that the cannabis produces. There are a number of social issues that have social costs associated with them that we have to look at. One is the public safety, one is the public health, and the other is the justice system. And those are some of the issues that were questioned in the article in the governor's budget relative to cannabis. In addition, right now we're getting no tax benefit whatsoever from cannabis in the state of Rhode Island. And I think now is the time, and hopefully we're able to work with the administration and all the parties involved to come up with a piece of legislation that will pass this year.
As you can see from the slide, it'll lead to a legal, well-regulated market with more efficient and effective control over cannabis-related industries. To Senator Gordon's question on that issue, cultivation is mostly urban, as the response is. It's mostly Pawtucket, Providence, Warwick. As we will get to later, our proposal allows for outdoor cultivation like Massachusetts has. It's very difficult and much more cumbersome and much more regulated than indoor cultivation. So there's not a lot of it, but it does create an opportunity if there's enough demand in the market to give that type of license out. But it's in there, but it gives a potential opportunity to existing farmers to get licensed to grow this very profitable crop amongst other crops that it can help sustain agriculture in Rhode Island. It'll increase revenue for both the state and municipalities, and it'll enhance programmatic funding for public safety, public health, and justice reinvestment. And it's, to Senator Sevigny's point, we have been working on legislation, both myself and Senator Sevigny, to have more predictable prevention funding and treatment funding that currently is law in Rhode Island, but is still not committed funding. And we have a commitment in this legislation to make sure there is that kind of committed funding.
If we can have the next screen, please. With respect to cannabis, as Senator Archibald said, there's zero tolerance in the state of Rhode Island when you're driving under the influence of cannabis. That's not going to change in this legislation. Hopefully in the future there's some testing that police have available to them, like the breathalyzer, to come up with accurate readings of what a person's level is, and then the amount in the system can be calculated to determine at what level someone would be impaired. This does allow an individual to keep up to 1 ounce of cannabis in their possession. It's not going to stop the home grows. You're going to still be able to have the home grows, and they're going to be able to keep 6 plants, live plants with them, and a total of 12 plants. And as a lot of you have probably been asked or commented, are you going to go outside and you're going to have a person next to you using the cannabis? No, public use is prohibited. It has to be at home or in a closed facility, not open to the public. In addition, it's going to be just like alcohol in a car. You can't have an open container of alcohol in your car. You can't have an open container containing cannabis in your vehicle. So there are those safeguards in there with respect to this. And as we move forward, we're going to talk a little bit about the Cannabis Commission, which will have a lot of authority to create, adopt, modify rules and regulations with respect to the process.
On the other side of this slide is examples from other states on possession limits. And Rhode Island is a 1 ounce possession limit and a 6 active plants and 12, which is consistent with these other states, some often less. And also to Senator Gordon's question about in-state, all states have allowed, because of federal control over this and the federal clash with these laws, all states allow for only product produced, manufactured, or grown within the state. So Rhode Island will also be consistent with that.
This legislation does create a Cannabis Commission, which is similar to Massachusetts. The commission would consist of 5 members appointed by the governor with different input from different sectors of government. In addition, this body, the Senate, would have advice and consent over those 5 members. They would have a staggering term so that their appointments wouldn't all end at the same time, so that there'd be some consistency with respect to the commission. The commission is going to be given a lot of authority and a lot of responsibility, and we see in Massachusetts, by doing that, it takes it away from the executive branch, it takes it away from the legislature once it's up and running, except for changes at some point in time the legislature could make for certain things if they saw fit. What it does, we're hoping that this commission, like in Massachusetts, is transparent, is accessible to all, as well as it's accountable to the legislature as well as the people of the state when it comes to the cannabis issue.
Yeah, here we give a list also of the composition of a Cannabis Commission. And another reason to take this Massachusetts model is it took Massachusetts a little more than 16 months to get this up and running. They had to extend several months. But having a commission has the kind of transparency that Leader McCaffrey talked about, both fiscally and in its operation and function. We know where all the revenue is going, we know where all the reporting is coming from, and we have the diversity through these appointments that you see in the slide.
And in this legislation, we create a tiered licensing for the different aspects of the cannabis business. And we have a range of fees from $100 on upwards, and we're trying to make it accessible to as many people as possible in whatever interest in it they feel that they can feel that they'll be successful, whether it's as a cultivator or a retail license. And we anticipate that the hottest license that to get is going to be a testing license. So that right there is something we would hope that the commission, when they go through this process, would be able to help us for that. But the testing is one of the most important things with respect to the cannabis, so we can know the quality of it, the quantity of it, and make sure it's meeting the minimum thresholds that are required. In addition, when someone applies for a license, if you have a past history with, say, a crime of some sort, we're not going to have that as an impediment to you getting a license. We're going to let the commission determine if that impediment that you have is one that would prohibit you from getting the license, or if it's something that would allow you to get the license. We don't want to say, if you have a certain violation on your record, you can't get a license. We want to leave the door open, just like we did last year with respect to Senator Metz's legislation regarding licenses. We're leaving it up to an authority to review it and hopefully make a judgment decision that they feel if the person gets the license, they're going to be safe and it's going to be they're going to be successful.
Also, since this legislation, as you see the licensing structure that Senator McCaffrey went over, we've already gotten some feedback. And one thing I've become very interested in after some of this feedback is potentially proposing a lower cost retail license based on square footage, probably somewhere around 1,500 square feet. So you do get that community-based lower cost retailer, which everybody, strives to get community inclusion and real entrepreneurism. And we feel that this licensing structure and this process versus a lottery is much more equitable and entrepreneurial in that it requires less capital and less risk of that capital than a lottery system where you may have to invest a lot in a business plan and upfront fees and upfront costs from consultants and financiers. And we feel that this lottery structure leads to that. Well, the lottery structure does not lead to that, and our structure does. The tax structure will be almost identical to Massachusetts with the 7% state sales tax and the 10% state special tax and the 3% to municipalities. New York is 9 and 4, so there is flexibility in discussing this when we get to other legislators and the executive branch. Local tax would be remitted to the municipality where the point of sale is recorded. And remaining tax structures will be deposited to a general fund, and we do anticipate some dedicated funding like you see in the governor's proposal.
With respect to the 3% tax, we're not going to limit it just to the retail license. It's going to be on any license, so that if a town or city has a number of cultivators, they will get a 3% tax on the, up to a 3% tax on the gross sale of the cannabis in that section of the licenses that they have. In addition, some cities and towns may not want to be participating in this at the retail level, and the councils in those cities and towns are going to have an opportunity to ask that for a referendum be put on the next election, which is in November of 2022. And at that point in time, if they do not want to, if they opt out, then they wouldn't be entitled to that 3% on the retail sales. But if they had the other licenses within their community, they would get the 3% tax on that. And with respect to the number of licenses, we're hearing it and looking at the budget article, they're limiting the number of licenses. We're not limiting the number of licenses. We're going to let the market determine the number of licenses that are out there. And we're setting a minimum that the cities and towns may issue if they see that is available, they feel it's available within their communities. And other cities and towns that have a larger population, they can increase their licenses for one license per 10,000 people. In addition, the current licensed facilities can apply for licenses, but it'll be a separate entity.
So there are lessons learned from Massachusetts and other states on how municipalities handle their licenses. Therefore, municipalities may regulate time, manner, and place of operation so long as it does not unreasonably frustrate a business in their process or in their ability to function when open. We envision a local sign-off whereby the establishment meets local zoning laws. We fully expect that, but there will be no additional costs associated with licensing. Massachusetts, as an example, municipalities have created both financial and regulatory burdens that have hindered a licensing process.
We've received a number of comments from the business community with respect to the licensing, and our employee is going to be able to prohibit or have drug policies that prohibit the use or possession of cannabis. Yes, they are. Can employers take disciplinary actions against an employee for actions of private use outside their business? No, they can't. Are they going to be protected if they're federal contracts or federal jobs? Yes, they are. They can have the same restrictions that the federal government requires with respect to those things. In addition, we're also saying that advertising is going to be limited because we don't want to have advertising out there where children and youngsters can see the cannabis ads and go out and try and get the product. So we do have some safeguards for children in there.
So if you go to the next slide, some of the justice-related components that we actually do have in the legislation rather than anticipating to put them in the legislation. we do have a cannabis equity fund, and it's comprised of all related fees from qualifying applicants. I believe that non might be a misprint, but, and so this is from all the funds from the licensing process. So all the licensing fees will go into this cannabis equity fund, and all the tax revenue will go to what we previously discussed. And it could be used to offset application and licensing fees and provide technical assistance to qualified applicants from disproportionately impacted communities. Funds may also be expended for restorative justice, diversion, and rehabilitation. So there is use for some of what we discussed to contribute to those efforts from the sales, but a full commitment to the assisting those from communities that have been hardest impacted. We also have a fee-free systematic expungement of cannabis-related offenses in the legislation. And it's as close to automatic as practically possible. The legislation, as you all know, has been out for the public to read and for other departments to read, including the court system, for a while now, and we do expect feedback on whether that expungement process will be administrative or otherwise a burden for our existing court system. And there already are alternatives being discussed, but we think this is an excellent start and is as effective, if not more effective, than the systems that have already been implemented in other states.
And carrying on with the expungement process, there was a lot of discussion on that as to how we do it, what's going to be done, and it's a evolving part of the legislation. Hopefully, we can fine-tune a little better. Also, the current compassion centers, we thought of them when we were coming up with this legislation, and we realized that they do have certain cultivation centers underneath their roofs, and we're saying if they get a retail license, they can use 50% of their grow capacity for their retail non-medical marijuana sales. In addition, they can apply for the retail licenses just like any other individual will be able to apply for them. I know it's a comprehensive piece of legislation. We know there's going to be a lot of input from different organizations and different individuals, and we hope over the next couple of months that we're able to come up with a final piece of legislation. At this point in time, I think we're open to any questions. If any committee members have any questions?
Yes, thank you very much, Leader and Chair Miller. We appreciate your presentation this afternoon. I believe Senator Quesada has a question.
Yes, thank you, Madam Chair. My question goes back to the first thing. They were talking about the license, $100 to things. If you have a license of $100, what does that mean? How many plants you can have in the house? Or I don't think if somebody going to have it in a big place, it's $100 license.
First of all, that $100 license wouldn't be for a house license. That would be a cultivator's license.
A cultivator license. Okay, that's what I mean.
And that would depend on the square footage of the grow area. And if you want it, we can obviously get you those details outside of this area.
Okay, sorry. My question is, one of the concerns that people have, so you had $100 and you don't have that many plants, and you go to sell and they don't want to buy it for you because they prefer to get it from the biggest cultivator, not from the small one. What did you do with this? What did you do with the marijuana you get? And people are afraid if you don't not able to sell them, and you keep it in the, whatever place you have it, and you keep accumulating them, that you can get in trouble. How much that you're going to be able to have with at your position that you will not be in a crime situation or in a problem?
Well, I know that the process we envision being set up as a seed to sale tagging process so that they would know exactly how much product that the person would have in their facility. And I think your question is, if there's not a manufacturer who's going to accept their product, what do they have to do with the product?
Exactly, that's what it is.
I mean, that's something we can obviously look at, but I mean, I assume different manufacturers will look at different product to see if it has the quantities of what they're looking for within it to come up with a decision to buy it. I mean, obviously
And that's what it is.
The-
Let's say that person do not qualify,
Yeah.
or whatever that person's selling is not enough for what they're looking for.
I mean,
Some people are nervous and afraid because it happened already. I had a few people who came to me and said, I used to be a small cultivator, and then when I had my product and I went to sell it, nobody wanted to buy it. And then I was so nervous and afraid that I had I think he said it was 5, 10 pounds, and he didn't know what to do with the product because nobody wanted to get it from him.
Yeah, we have already heard from cultivators of many scales to the very small to the very large. And that's one reason why the cultivator licenses go from $100 for somebody who's going to grow a very specialized product that will only be sold to one retailer. And then you have up to $20,000 for a large scale indoor or outdoor grow, as I talked about. Currently we don't have outdoor grow allowed in Rhode Island. This would evolve into outdoor. And we've also heard from cultivators, and this is an important point to make, they're afraid too many licenses will be given out. A Cannabis Commission would look very carefully at the marketplace in real time on a regular basis to make sure they're not over licensing so that people are driven out of business that have already invested in and one of the reasons they have invested in medical cultivator licenses is a potential extension of their license and transfer of the license to a retail operation. So we don't want to neglect that investment, and that's why there's a full range of cultivator licenses and careful monitoring to make sure the process actually grows rather than discourages from people to entering a cultivation industry.
All right.
Thank you. Thank you, Senator.
Thank you.
Next is Senator Archambault.
Thank you, Madam Chair. I have a question that perhaps the leader or Chairman Miller can address, and it has to do with the disclosure of use of medical marijuana in the workplace. We have a letter from the Rhode Island Manufacturers Association, and I went over it fairly quickly, and they talk about in it some of their concerns. One of them is that the medical marijuana statute needs to be strengthened with respect to the disclosure of who's using it at work. And right away, Senator Lombardi will relate to this 100%. We do a lot of personal injury. There are HIPAA forms and HIPAA laws to protect against the disclosure of such information. So how can somebody who's got a legitimate medical marijuana card and is using that prescribed by a doctor suddenly find themselves under the Monday morning quarterbacking of a workplace situation where the question spawned is, are you using the drug? And so then you've got somebody micromanaging a doctor's prescription of the drug when there may be no impairment, they just have it in their system. That causes me great concern. And that should cause everybody on this committee great concern. Imagine your doctor prescribes you a medication, forget about marijuana, they prescribe you something for anxiety, they prescribe you something for pain management. And then you're protected, right? You got HIPAA laws to protect you. Suddenly you're in the workplace and the question becomes, hey, you have to report to your supervisor. And you're sitting down with a layman and they're asking you invasive questions, violating your federal protections through HIPAA laws. What are you using? How much are you using? I'm not sure. And then somebody who's a layperson makes this anecdotal opinion about where you're at based on what they think about the circumstances, and suddenly you're discriminated against. And that'll happen under the way, I know this law is not perfect. I know we're all rowing in the same direction and we're working on it, but this is the time for the discussion. And it should give everybody on this committee great concern that the workplace wants to micromanage HIPAA disclosures. That shouldn't happen. That shouldn't happen ever. If you've got a medical marijuana card, you've got the card. You shouldn't have to go and sit down with somebody in the workplace. Now, if you're impaired You come in, you say, I've got a medical marijuana card, but you just went out and smoked some medical marijuana, and you're, forgive me for the slang, but you're high as a kite, and you come back, all right, there's a concern. Maybe somebody will take your side and tell you shouldn't be in the workplace. But I put forth that that's probably an aberration. That's not going to be the norm for somebody who's got a legitimate card and really using it. So I think we need to be careful with this section and not go in with a hatchet and just say that we're going to allow any employer to have the authority to micromanage and go beyond, pierce the veil of HIPAA laws.
So, what I would say, Steve, is obviously those are important issues that you're bringing up, and we will take that into consideration. But also, we do have some employers who have zero tolerance because of the nature of their business. You can't work at EB in Quonset unless you have a zero tolerance when you go in there, and they can randomly test you along the way. But if it's other businesses, I think that's something maybe we should look at and maybe make accommodations for that.
Yeah, I also think that this is a very good reason for people to understand, and if they have a medical marijuana, if they're consumer of medical marijuana, to stay within that medical marijuana program. Because there are, as you indicated as part of your question, there are reasonable issues and important protections about employment and use of medical marijuana. But it should be understood, and this legislation strives to have it understood, that if you're not a medical user, an employer has the right, as they do have the right, to drug test currently and dismiss or discipline an employee based on a recreational drug use, that if they don't have a medical marijuana card, it's understood that they might have an issue with their employment on recreational use. And those are clearly delineated currently in law for medical users and consistent in this legislation that recreational, an employer should have some discretion to discipline or dismiss based on recreational use.
Senator,
If I could just follow up quickly, it's if I may, Madam Chair, it's refreshing to have the question answered and addressed. Both of you guys nailed it, and so, and clearly, if somebody's in a job where they're going to consent by contract to have a zero tolerance for drugs, then they subjected themselves to that, and that's fine. That takes that category right out, and that's for all the other concerns. I feel a lot better having your answers to that question. You put a lot of thought behind it. Thanks.
Thank you, Senator. Senator De Palma.
Thank you, Madam Chair. Just a comment for both the sponsors, and just to follow up on the question that Senator Archibald asked. I'll start with the latter first. So, Senator, some of us on in fact, on this call here, I think at least two of us, there might be more of us, I think three, have security clearances. So we couldn't have a security clearance. One of the conditions of having a security clearance is, in fact, restriction on marijuana. So that's part of the challenge, and it's, as the leader indicates, with electric dope and the thousands of folks that work on Aquidneck Island, a fair number of them, not all of them, in the defense economy will be restricted to that. But I want to thank the leader and Senator Miller for opening up the aperture. Whatever we do at the end of the day, we need to be successful with. And I think that aperture of opening up and let the market drive where we go is exactly the right answer. We as a state don't. Nobody has the keys to the kingdom with regards to doing this. The state is not in the business of business. We should not be in the business of business. The market should determine where things go, and the commission and the work that they will do and where this goes forward is absolutely the right thing to do, and let the market bear how many should be out there, as opposed to we set that number up and cause more conflict and consternation in the way forward. But I know a number of hours you folks are putting in on this, so thanks on that. Thank you, Madam Chair.
Thank you, Chair De Palma. I believe Senator Rogers has a question.
Thank you, Chair. I just wanted to add another list of people that wouldn't be able to, even if they had a marijuana card. CDL class drivers, that's everything from DPW workers to state truck drivers to bus drivers, from the whole list on down, zero tolerance with a federal CDL license is many times it's part of your employment. And if you fail, you lose your license and you can't get it back. So, we may have, as the increase of this goes up, cannabis goes up, we may have some job fallout from it. But these people understand holding that license, the importance of it, and what they can and can't do. So I just wanted to add that.
Thank you, Senator Rogers. Do we have any other questions of committee members? If you could just either raise your hand or shout out. Okay, very good. Thank you, Leader McCaffrey and Chair Miller. We see no other questions at this time. Okay, very good. Next, we're going to go to Senate Bill number 192 by Senator Reptakis, an act relating to Food and Drugs Medical Marijuana Act. Senator Reptakis, if you want to explain your bill. Okay, Senator Reptakis?
Your mic's off, Senator Reptak.
Oh, there you go.
Very good.
Thank you, Madam Chair. This bill comes from a incident that took place at a facility, a marijuana facility, back in December, where we had an individual employed by the company or maybe by a secondary employment company that had, there was no background check required by anyone working in a compassion center. So that's number one. I think while we're discussing medical marijuana, while we're discussing increasing the number of facilities, I think it should be a requirement that anyone that is employed, whether it's third party, a director or manager, to have a background check. It's important. We do it for daycare centers, we do it for hospitals, we do it for nursing homes. So that's number one. The second part of the bill, line 14 to 18, gets a little bit tricky. So I looked at the bill, I would say that we would tighten that up and make it for anyone convicted of a felony, whether they should be allowed to be employed. I know that the language of the bill is a little bit loose between line 14 and 18 regarding anyone that has pleaded guilty of NOLO, but I think that if we can tighten that language to make it that it's a convicted felony, I just think it's absurd that we don't even have a background check that's not even required. So as we move forward, I hope we can incorporate this bill of the intent of the legislation into one of the bills, whether it's going to be Article 11 or 568, to be part of the discussion on making all these facilities be strict and abide by by our current statutes as far as working at like again I said, daycare centers, schools, nursing homes, whatever the case might be. And thank you, Madam Chair, and members of the committee.
Thank you, Senator Reptakis. Any questions for the senator on his bill? Okay, I have two full screens.
Madam Chair.
Senator Archambault.
Yeah, just very quickly, I appreciate what Senator Reptakis being so sharp and listening to these bills and adding that in, because I co-signed his bill, and I didn't catch it. As I was reading it, he just said it. If you make it for a felony conviction, not everybody gets convicted of a felony. Some people actually might be arrested for a felony and say they take a deferred sentence or probation. Honestly, you don't want to preclude those people from getting employment just because the category kicks them into a felony. Say it's a dollar value for a larceny that's a little more. You don't want to preclude them, but not everybody gets convicted of a felony. You only get convicted if you get a jail time and it's suspended. Remember that. That's like the end of the road in felonies. Thank you, Senator Reptakis.
Thank you, Senator Archambault. Senator Acosta, did you have your hand raised?
Yes, thank you, Chairwoman. And Senator, thank you for this bill. Can I ask, given some of the things outlined in Senator Miller and the leader's bill, is this the kind of thing that you could live with being under the purview of the commission that they propose? And so the idea of bundling this into not just medical marijuana, either cultivators or dispensaries or providers, but also recreational, and having folks be able to come before a commission or a board and explain what their charge was, and have that board delineate what types of offenses would preclude you from being able to be in the industry versus which would not?
Yeah, Senator, the issue here is we've got to be careful which avenue we're going to. Are we going toward the judicial avenue and letting judges make this decision? Or do we allow the board? Again, it's kind of new. So I think we'd be very careful, like what Senator Archibald says. Who makes the decision? Would it be a judge after the person has been convicted of a felony, whether to allow that individual to be employed in a facility like this? You're right. We've got two different paths, and we got to make a decision. So we can have a discussion to figure out which pattern. But I think that basically we should have a background check because we don't. Number one, that's for starters. That we definitely should have. Then the issue is allowing the employment question is, do we allow, like you said, I believe the commission under the Miller-McCaffrey Act or law to make that decision? Or is it whether do we allow somebody to work in the facility, whether they're denied to be employed? Again, that's a good question. Where do we allow that to fall? Would it be in the courts or would it be in that commission you just described? So again, it's open for discussion and we can try to tackle it somehow.
Thank you, Senator. Senator Jacone, I believe you have a question?
Yes, Madam Chair.
Go ahead.
It's more of a statement to a question in the statement.
Proceed.
In your, Senator Papakis, in your bill, anyone convicted of a felony, any type felony?
Again, Senator, that's a good question. I'm not sure under what statute of felonies it would fall because there's a lot of felonies. So we want to just be careful. I mean, I would like to see what do we have as far as employment for a daycare center, a school, a nursing home, a hospital. We want to make sure whatever felonies we apply in other businesses, I don't think we should single out making a compassion center or medical marijuana facility less lenient. So I think we should be fair. And if somebody's denied employment, let's look at other facilities or other employment agencies or venues, what we do as far as denying employment. So that's a good question. Again, I don't have that answer to know what felonies they are. I guess I'm looking at the bill right now. It's not attached to any specific.
Senator?
I think his screen is buffering.
Okay, let me just continue. I know somebody that I helped out probably 4 or 5 years ago that had a felony conviction not related to marijuana, not related to any type drug offense, and in going back and forth with the DBR and mentioning other states, I believe their rule is now if it's a felony that involves the use of marijuana or any controlled substance. Outside of that, they don't preclude anyone from obtaining employment. I mean, in this case, the felony was probably 10 or 15 years prior to the application. So